Pattaya City Expats Club is a non-profit social organisation and our speakers are volunteers. The club as such assumes no responsibility or liability for the professional reputation of or the quality of services provided by the speaker today.
G'day and Swadee Kub. Well, today at the Expat Club, we were really privileged to have an incredibly clear talk by Dr. Benjapa from Bangkok Pattaya Hospital. How long have you been working at Bangkok Pattaya Hospital? How many years?
I've been doctor for 6 years and I work in Bangkok Hospital Pattaya for 1 year.
All right. So it was incredibly clear. I cannot recommend it too highly. And you emphasised 8 areas that people had to monitor or improve.
Mm-hmm, yeah.
What are the 8 areas?
Okay. The 8 areas we are called Life Essential 8, recommended by American Heart Association. You mean summarize?
Yeah. What would you say is the number 1 of the 8?
Oh, I would say the number 1 is the one you can do.
There's a cop-out for you. So it includes what you eat.
It includes eat better, be more active, avoid alcohol, avoid tobacco, and sleep well, reduce stress, and what else?
Blood pressure?
Yeah, blood pressure, monitor your cholesterol and your body weight. 8.
Yeah, so these are incredibly important indicators and stuff. And say, as people get older, how often should they go for a checkup? Firstly, I think you recommend that they should have their own blood pressure monitor at home.
That's right. People should normally monitor their home blood pressure. But for the answer of when and how often we should have checkup, starting from every age. And if there's no problem, maybe 1 or twice a year.
Yeah, because it's incredibly cheap to get a blood pressure monitor now.
Right.
You know, you get on Lasada, it's like really ridiculously cheap. And of course, there is the problem of the white coat phenomenon, isn't there?
Right. White coat phenomenon is the thing that I see it every day. People, they often have high blood pressure upon the visit, but when they were at home, their blood pressure becomes normalized. So the importance is home blood pressure monitoring rather than depending on the hospital's blood pressure.
So last time I got checked, it was 117 over 77.
Okay. From the hospital?
At the hospital, yeah.
117.
Over 77.
Which is normal number.
It doesn't get much better than that, right?
Yeah. Maybe at home a little bit lower, but I think not much. Maybe you don't have any nervous with the white coat.
I'm good at chilling myself and relaxing and stuff. But, you know, I know a doctor, and he gets white coat syndrome if he has his blood pressure taken in a hospital. The doctor, do you have white coat syndrome?
No, I don't.
Okay, so get the blood pressure monitor at home. They're very cheap to get online. Yes. So that's one thing. What about checking your cholesterol, etc.?
Okay, so monitoring with your blood sugar and cholesterol is very beneficial. I would recommend to have checked once or twice a year because sugar and cholesterol, they runs in the blood and they slowly, quietly, but permanently damage the blood vessels. So if you are saying, I feel fine, I don't need any checkup, once you feel unwell, that's very alarming thing. So better get checked, be prepared, prevent them from anything ever happen.
And of course, eat well.
Yes.
And so what's say the main things to avoid eating or eat very little of?
The eating would be 4 do's and 4 don'ts, but the thing that should be avoid, definitely first, added sugar. By added sugar, it comes in every form: syrup, maple syrup, sweet beverage. Also avoid sodium. Sodium comes with salty food, of course, canned food, pickled food, which if avoid will definitely keep your blood pressure normalized. And also the ultra processed food and the saturated fat, try to avoid them if you can.
Yes, exactly. And of course, exercise.
Yes.
What particular exercises do you recommend?
Okay. Same thing is the exercise I recommend is the exercise that you guys do, okay? Because it needs the simple sentence is every step counts, meaning that you walk 10 more steps every day. It's better than walking 10 less steps, you know. So movement in every day counts. But to be like academically, it would be 150 minutes of moderate aerobic exercise. For example, walking, gardening. But vigorous exercise, such as like running, it would be 75 minutes. You can mix them and spread to other weeks. It would be only 20 to 30 minutes a day, which I think that is not too hard, right?
Yeah, no, and people, they try to do the 10,000 steps a day. By the way, as you get older, or even when you're younger, gave a talk on this, walk carefully, walk consciously, because so many people injure themselves, especially as they're older, just walking because they're not paying attention. They're doing it on the phones. They're walking down steps and not paying attention, not having a hand near a rail. And as you get older, you probably shouldn't be on a motorbike after a certain age because your legs get weak. And had a friend recently, his weak legs, he was backing his motorbike out of somewhere, fell over, broke his leg. So you really need to walk carefully, walk consciously when you do walk. I tend to do probably, I don't know how many minutes I clock up, but I do the high intensity interval training, the re-hit, right? So I run 3.5 flights of stairs, walk down, run another 3.5 flights of stairs, walk down, do another 3.5 flights of stairs, and I do that every 3 days. So that's rated to be one of the very, very most powerful things you can do for your body, including your heart.
Right. That's right. I definitely agree. Yeah.
But you've got to be fit enough to do that. Right? You don't want to just think, oh yeah, my heart's good enough to run up 3.5 flights of stairs. It's flat out. No, you've got to have a checkup before you do that, or be really know where you're at. And of course, I also do systematic weights. I do Tai Chi and I do stretches and stuff. Yeah. Tai Chi is very, very highly rated.
Yeah. That's right. Besides from the aerobic exercise, I would recommend, of course, muscle strengthening exercise, which will definitely protect your joints. For example, like squatting or muscle resistance. Besides from that, yoga, stretching definitely works too.
Yeah, to really cover those sort of different bases and work out. Apparently, squatting against a wall is really good now. I've just started to incorporate that. Right. So you can learn an awful lot from this talk. Your heart's important. Spend 40 minutes plus listening to this amazing talk and the questions and answers afterward. Thank you so much, Dr. Benjapa. Such a really, really important talk. And thank you for the team from Bangkok Pattaya Hospital for organising it. Do you have one last message for the people out there about their heart?
Okay. It would be the same message I give into the room. Remember, your health is your greatest wealth. The best investment you can ever make is your own health.
As I like to say, your body comes first. When you wake up in the morning, don't think, I'll fit that exercise in if there's time. Your body comes first. Thank you, Dr. Benjapa.